Nation of payments paid to drugstores from drug makers. That will certainly impact the bottom line. Prescriptions account for almost half the company's sales.
Health this morning. Thanks, Bob. A concept well known to pharmacists, but not very well known to a lot of patients. It's something called compounding, and Joann Marini is here from Dell Pharmacy. Now, I know a little bit about compounding only because we had a cat once that could not handle pills, so we had to get a liquid medication made up, and that's all compounding is, right? Just changing the form of medication.
It's more than actually just changing the form of medication.
Okay.
Basically, we have commercially available products that meet the needs of the majority of the population, but there are some people who have trouble with allergies, sensitivities, that type of thing. With your cat, you had to change the formulation because the cat,
right,
you know, it was more difficult to administer the medication. We do everything from topical forms to capsules, suspensions, bioidentical hormones are very big. It's basically thinking outside the box. The sky's the limit.
Okay, so it's taking the compounds and just changing the form of them, I guess, kind of thing. In some
way, yes.
Okay, in some way. Okay, so what are ways, if I can't take a medication, maybe because I can't take a pill or something like that, what else could you do for me?
Options are, if you couldn't take a pill, if it could be compounded in a suspension.
Okay, so that's a liquid?
Syrup, in a liquid form, absolutely. Okay. The art of flavoring comes into the compounding as well.
Right,
so
and that's a big thing for kids, isn't it?
Absolutely.
Yeah.
Absolutely. Other options too, we can make lollipops. And once again, if you make lollipops or lozenges, troches are another thing, and they're very similar to lozenges. And basically, what people need to remember is if you're using this form of medication, you need to take the whole thing. So if you're taking a lollipop, you need to, ingest the entire amount of the lollipop.
And is it the same effective dosage and everything?
Yes, absolutely, absolutely. Like there's a standardized process. We have formulas, recipes that we need to follow, definitely.
Okay, so of course, the first thing I pick up when we're on the table, I'm like, oh, what's this? Not knowing what it was. I'll let you touch it then.
I apologize to the viewers who are eating breakfast. This is a rectal rocket, and basically, it's exactly what it sounds like.
You're turning red.
No, am I? No, I'm not really.
You deal with this stuff every day. I'm like, oh, what's this?
You know what? The reason I brought this is because it truly explains thinking outside the box and what compounding could be or is all about. So what you have here is basically it's a rectal rocket. It stays in contact with the area for 4 to 6 hours.
Okay.
So you're able to treat both internal and external hemorrhoids, and anyone who suffers from hemorrhoids may have weeks of treatment.
Okay.
So the idea of a 2-day treatment is phenomenal. And very interesting thing here is this gap.
Okay.
And it's called a flatulence gap or a flatulence groove. And that's
why did I ask about this?
That's why it allows the product to stay in place for that length of time.
Okay.
So that's the idea, is thinking outside the box.
Now, is something like that very good too for, say, a patient who cannot, is simply like throwing up so much that you cannot stomach anything inside, right?
Exactly. Exactly.
So, I mean, as much as we joke about it, it's a really, really, really serious thing. And what about the topical as well? That's very interesting. So you could put something on in a cream.
You can, and depending on the base, it can actually pass through the skin barrier.
Okay.
So the idea, for one thing, this is something called a Topiclick, and we usually use this for bioidentical hormones.
Okay.
So what you're doing here is basically when you click the bottom one turn, it delivers 0.25 mils of cream.
Okay, so that's exactly what you need then.
Exactly. And I mean, once again, we can modify the formulation based on the patient's need.
Okay.
And that's the big thing.
So just quickly then, is this something you need to talk to your doctor about? It's like, oh, I can't take this, or is this something you have to talk to your pharmacist about?
I would say it's a combination of both.
Okay, so the doctor instructs the pharmacist then. Okay, Joann, thanks so much. It's been a real eye-opener. Okay,
Thank you.
Now we're heading out to Leslie.
All right, thanks, Annette. We're going to take a